Congressman, I'm a resident of Franklin County. I want to start by thanking you for coming out and listening to the concerns that folks have. To set the context, I'm a Democrat, I'm a social liberal, and a fiscal conservative, which makes this whole issue kind of difficult. Actually, I mentioned that to somebody earlier this morning, and they wondered whether I was from the Christian left. My concern is not with the thrust of the health care reform bill, because I'm proud to be a member of the third generation of American history that has tried to tackle this problem. I hope to be part of the third generation of American history that solves this particular problem before us. And I commend the people in both parties, Democrats and Republicans alike, who are tackling this issue and trying to get reasonable, reliable health care for all American citizens. My concern as a fiscal conservative is I don't think that I personally, maybe others in the room have, but I personally have not heard enough about how it's being paid for. And I think that there are really two areas of funding which appear to me to be not on the table for either Democrats or Republicans. One is tort reform. And the second is the insurance company profit margins, which far exceed the overhead of the Medicare system that those who are opposed to a federal solution to this problem, they object to that, but the numbers are clear. And the reason I would support a federally subsidized program is to bring the insurance companies in line. I would be less in favor of that if Congress were able to control the profit margins and the rates of the insurance companies, just like we seem to be able to do with utility companies.
Well, looking at the question of the pay-fors for the second gentleman, two issues that were raised. First is the issue of tort reform. I am a supporter of tort reform. I think that the costs of tort reform come in on several levels. First, there's the cost of the litigation itself, which is a relatively small percent. There's the cost of the malpractice insurance, which is a bigger chunk. And then the cost of defensive medicine, which is one of the core costs of the system, namely people ordering tests just for the sake of covering their you-know-whats. Now, there is an additional cost, though, and coming from a family of doctors, I really hear this a lot, which is the cost of taking the joy of practicing medicine away from so many of our doctors who got into it out of a sense of calling, got into it to try to help save lives and cure disease, only to feel like they're always playing defense and not knowing whether the next person is coming in trying to find a way to get rich quick. So I agree with the problem. I think the approaches that have been taken so far have been backwards, and I'll tell you what I've floated. The approaches so far have mainly focused on capping the penalties once someone's done something wrong. In my mind, the problem in the system right now isn't where things have been done wrong, it's all the frivolous lawsuits when nothing at all was done wrong in the first place. So what MCV has done on a private basis with a great deal of success is where the medical community sets standards of care. And if those standards of care are met, there's a rebuttable presumption of no liability. In other words, if you do what doctors say was the right thing to do, then you can't bring a case. It's rebuttable because if something egregious did happen, you can still go out, and there are horror stories out there. What you've seen with the MCV example in that is two things. You've seen a reduction of litigation, which is great, but you've actually also seen a reduction of medical error, which is also great, because so much thought went into the process of setting those peer reviews. So some of that can be done directly through the hospitals without laws, but I think what we really should be looking at the federal level is some form of tort reform along those lines to try to choke out the suits. I floated that in July, and we'll continue to fight for that when we get back in September. The issue of insurance company profits, it is true that 23 cents on every private insurance dollar goes to insurance company profits and overhead, whereas you only have 3% in Medicare. I think the solution to that is not to tax their profits, it's to create the competition where it doesn't exist right now. One of the other major problems with driving up cost, in addition to the cost of the uninsured getting dumped onto those people who have private insurance, is the fact that we don't have competition. 93% of our healthcare markets don't meet antitrust standards. I know there's a lot of interest, and I like it, in portability across state lines for more competition. That's tended to be a federalism issue where states feel like it's a states' rights thing to control that, and I'm generally pretty sympathetic to letting things happen at the state rather than the federal level, but I think that's become increasingly in tension with the principle of competitiveness. Particularly with the internet and other things, the ability to be able to purchase and shop for and compare insurance companies across lines. The other issue where these two things come together is the issue of the exchange, which is right now of the 47 million uninsured. These are, in many cases, not the poorest of the poor who are already, say, on Medicaid, but we're talking about people who actually can afford to pay something into the system. You have about 12 million illegal immigrants in that category. I'd love to tell you we solved that problem. We don't make it worse, we don't make it better. There's basically a punt on that issue. The bill says no funding for illegal immigrants, but the reality is they're going to still go to the emergency room. Neither party right now seems to want to touch that issue. So look at the other 36 million for a second. The biggest groups are people aged 50 to 64 years old who have lost a job or are self-employed and private insurance doesn't want to pick them up. Pre-existing condition or family member with pre-existing condition. People who are self-employed part-time or working for a small enough business that they can't afford to carry that. And young people who either think they're immortal or just want to, haven't gotten a job yet or what have you. If you take any of these individual groups together, with the exception of young people, insurance companies pretty much don't want to pick them up. But if you say, here are 35 million potential paying customers, we want you to compete for their business, then that's something the insurance companies are extremely interested in. And that's the kind of competition that could lead to the kind of affordable prices. That part, where you would create this exchange for the uninsured to buy insurance, is actually something pretty much all the doctors and hospitals consider fairly uncontroversial, because it's also going to require unified billing, which reduces paperwork, and an 85% medical loss ratio, to your question, meaning at least 85 cents of every dollar has to be spent on actual medical care. What becomes controversial, I think, is not the idea of getting people who are currently getting the insurance for free to start paying for it. The issue is, okay, well that's all well and good if we're just dealing with the uninsured over here and everyone else gets to keep their system over there. The difficulties come up, and I think these are genuine difficulties with how do you make sure that people over here get to keep the system they have? Do you put a really high penalty on any business that drops private insurance? Do you simply regulate it so that you're not allowed if you had if you're grandfathered into an existing thing? What about the products on that shelf? In addition to private insurance, should there be a public option, which is one of the debates? Should the uninsured be required to buy one of these options or not? And there you have sort of, again, a libertarian trade-off in the same way that I think the state competition issue puts two principles against each other, which is, on the one hand, it seems like you should have a right to not carry health insurance if you don't want it. On the other hand, if you decide to buy a TV instead of health insurance and you wrap yourself around a tree the next day, the rest of us have to pay for it. So over 60% of personal bankruptcies are because of medical care. Even people who've done everything right, when they hit that catastrophic cap, going into bankruptcy, etc., that all comes back on us. So the other libertarian principle is, why shouldn't everyone have to pay into the system if I know it's going to come out of my pocket, again, even under the existing status quo? So I think in terms of going after insurance company profits, there are some things that start out as very simple ideas and then trying to prevent the unintended consequences.